thank you. You're now listening to the Revolution.
Presto on the beat. Presto on the beat. Presto on the beat.
You're now listening to the Revolution. Right. 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 Resume got that sauce. Right. 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 Resume got that sauce. Right. 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 Resume got that sauce.
Hello, everyone. Good evening. How are you doing today? Hearing the echo? So we, can you guys hear me? Give me a I don't know, a thumbs up in the chat if you can hear me. Can you hear me? Let's have fun. Let's ensure that we're, yes. Okay, great, great. Today's going to be amazing. Today's going to be so much fun. Welcome, 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 everyone. I know I'm excited, as you can already tell. So I hope you're also excited. This is the third annual community forum for the collision for the advancement Nigerian mental health. And I am your host today, and I'm really excited. My name is Amarachukwu Okoro. I'm excited for today. I think it's going to be an amazing, amazing discussion, as you can see from the beautiful theme of this year's forum, and it's Our Voices Rising, Nigerian Mental Health Policy. We're gonna have a lot of fun. I know when people think of mental health, they're like, oh, this is gonna be like maybe a sober moment. No, we're going to have fun, and we're going to discuss, and we're going to ensure that we're all leaving here with so much information and so much knowledge. So I am an interactive host, so I like the chat box to be running. So I will ask you a lot of times to interact back with me in the chat box, okay? So just give me a, thumbs up if you're good, if you're excited for the third annual community forum. I'm excited. You should be excited as well too. So without further ado and not taking too much time, we're going to quickly just introduce our lovely, lovely conveners as well too, so they can touch a little bit about what the Coalition for the Advancement of Nigerian Mental Health is all about. Just being a little bit even about the coalition, it really is inspiring, because a lot of times, especially knowing that it came as an aftermath to the NSARS, and just knowing for the fact that a lot of people would think that during NSARS and after, people were just discouraged. But these two lovely ladies made the decision that they were going to do something about it and do something about contributing something to the Nigerian community. So without further ado, I would introduce them, so then that way they can speak a little bit about the Coalition for the Advancement of Nigerian Mental Health. Demi, Mercedes, Dr. Mercedes.
Hello, everyone. Thank you for joining us again for another year where we can gather to talk about important mental health issues in our community. I'm Dr. Mercedes Okosi, and along with Lola, we together, almost 4 years ago now at this point, founded this organization with the idea that we would spread awareness and accessibility of mental health information to Nigerians and by Nigerians across the diaspora. So we're happy that you're joining us today.
Yes.
Yeah, I also just echo that. So, oh, sorry, Amarachi.
Oh, damn it,
echoing that. Thank you, everybody, for joining. And yeah, we'll talk more towards the end of this event. But, we have a good lineup set up today. So I hope everybody, has their notes and everything. And we can all kind of take some call to actions away from here. So thanks for joining.
Yes, thank you so much. Once again, hey guys, let's quickly, be a little bit distracted. Can you see beautiful women that are doing beautiful things? Come on. Gosh. So thank you guys so much, and thank you so much for this initiative. It's a great honor to be a part of what you guys are doing. But yeah, so just to further on, we have a lot jam-packed for today. It's going to be exciting. Of course, we have breaks, but there will be a keynote speaker. There will be panel sessions, Q&A. It's going to be something that you really want to ensure that you're engaged in. And definitely, I'm sure they would want you to also take this wealth of knowledge you're going to get today and, implement it to what you're already doing, or maybe let this be a kickstart to something new and something innovative that you can contribute to our great, amazing nation, even as we're in the diaspora and everywhere else that Nigerians, honestly, we're everywhere. I know, I'm sure everybody can definitely attest to that. So without further ado, we're going to introduce our first speaker for today. And I would just plead with her in advance to please not be angry at the way I may pronounce her last name, but I will do my best. Our first speaker today is Sandra Anya Ebi. Mrs. Anya Ebi is the psychologist and founder of Psycho Babble Foundation. No, Psyche Babble Foundation. Psyche Bible Foundation is a youth-led, not-for-profit organization in Nigeria, registered under the Corporation Affairs Commission, CAC, with registered number. Psyche Bible Foundation is a mental health organization dedicated to raising awareness, reducing the stigma, building better lives for the millions of individuals living with mental health illnesses. Oh, sorry. Okay, I was reading. Okay. When you made it anyway. Sorry,
Oh, you're good.
Dedicated to raising awareness, reducing the stigma, building better lives for millions of individuals living with mental health illnesses, and promoting overall mental health for all. In 3 years of active service, Psyche Babel has directly supported over 1,500 plus young people with their mental health by providing psychotherapy, mental health counseling, as well as psychosocial support, and over 10,000 plus indirectly through community outreaches, training, and social media. Sorry, every time the thing goes big, it makes me lose what I'm reading. Where was I? Yes, 10,000 indirectly through community outreaches, training, and social media campaigns. The organization, through Sandra, has also provided mentorship for over 35 young professionals in the field of mental health in 2 years. They currently have mental health support groups facilitated by mental health professionals ongoing on this year 2023. I did myself stalk her a bit, and her page is amazing, and she's really doing amazing things. So I'm really excited to hear the wealth of knowledge. And of course, she was again a beautiful girl. Come on, woman, sorry, don't girl. Beautiful woman. So without further ado, Sandra Anyebi. Hopefully I pronounced it properly. Yes.
Okay. Hi, everyone. Good evening, good day, good morning, good afternoon, wherever you are. Here it's evening, so good evening, everyone. I hope you can hear me. Please ignore the sound behind or at the background. There's a birthday party somewhere and for a child, and I'm very tempted to go to the bouncy castle. But my name is Sandra Yahibi, and yes, Dr. Mercedes, I think you did amazing pronouncing my name. Well done. I think that was Dr. Mercedes, right? I hope so.
That was Amarachi, but yes,
Dr. Mercedes. Oh my bad, I am so sorry. But thank you so much, and it's so good to be here. I am so excited to be here. Thank you for having me, guys. Do I have the floor now or afterwards?
You're good.
Oh, okay, great. I think I'm supposed to speak about the work that I do, correct? Great, so let me see. I just wanted to share. Hi, guys, I see the comments, thank you. So I wanted to see if I can share my screen a little bit or quickly so I can, I have prepared something so I can just, I don't know how this works though. Please let me know if you guys can see my screen at any time.
We can see your picture, but
I'm not sure what's happening. 1 second.
Yeah, we see that it says you started to share.
Okay. Because my laptop currently just died actually. So I'm trying to navigate this with my phone, depending when it's currently plugged in anyway. Okay. So I'm hoping this works. Sorry, you guys, my sincere apologies for this. This is not how I usually operate. Anyway, so please let me know if you can see my screen now.
Yeah, looks good.
Okay, thank you. So, like I said, my name is Sandra, and I am the founder and the lead psychologist at Psyche Bible Foundation. Psyche Bible Foundation is a youth-led NGO where we provide mental health services, mental health care, mental health support to individuals both home and abroad. We've also been able to provide this free counseling, particularly to even non-Nigerians, because again, we do not discriminate as much as it is for Nigerians. So we try to advocate for mental wellness, we try to raise awareness, we do this through education, capacity building trainings, mentorship. We also do advocacies and so many other things. But yeah, that's pretty much what we do at Psych Bubble. But one of the core parts of our projects is always the free mental health counseling. So we have the free mental health first aid or free mental health counseling that is always available to anybody. So we know that therapy can be a bit pricey in this part of the world, maybe pricey for the average Nigerian anyway. So we've provided this method or this service in a way that if you're not able to afford therapy right now, you are still able to get access to someone, a trained mental health counselor to help you walk through whatever it is you may be going through. Because one thing we do believe is that everyone deserves access to quality mental health care, regardless of where they are, who they are, and all of that. So our mission is always to give mental health a voice in Nigeria and globally. And also we provide, like I said, the free mental health counseling. We educate people. This is our mission, to create a safe space for people. And you see this through our monthly support group that we've been having this year. Moving forward, so some of our services I had already highlighted. We have the mental health psychosocial support, which is we do some of this through community outreaches and then our free counseling service. We also organize trainings, and then we have referral services for individuals who are ready to and can afford therapy but don't have access to therapists. We have therapists in our database who we have vetted, and we can actually 100% recommend them for the work that they do. So we have those, and then we also provide mentorship for young psychology graduates of social work, guidance and counseling, just so they have a stepping stone as to building their career in the mental health space. Some of the things we have done so far, we got registered in Nigeria in 2019 December. So since then, we have provided our free mental health counseling to over 2,000 individuals because they have used that directly. So they literally have over 2,000 people have spoken to at least one of our counselors since 2020, when we officially launched the first aid counseling program. We have also provided free therapy to individuals who struggle with, sickle cell warriors through a foundation called ELCOM. So through their foundation, we provided free therapy for their for members of their community, and we still do to today. And then also, we also have community outreaches, some of which we did one at Makoko in collaboration with another organization called ASAD. We have also done some community outreaches to Surulere, to Unilag, and also a couple of other places. We've also provided therapy for NSAS victims through another organization as well called Listening Ear Africa. We collaborated with another organization, which is B Network, towards providing a trauma support group. And then we had worked on a sexual assault awareness kit with an organization called JK&O. It's a company. And then we lodged over 45 calls during the NSAS, like the actual NSAS day. So we had a hotline, set up a hotline for individuals who were experiencing panic attacks and struggling with their mental health on that day. And then we have supported about 23 kids in an orphanage with their mental health. So last year, our major project was Project Love Home, where we went on a particular orphanage. Instead of the usual one-day visit, what we did was we were present with these kids every single month. We had a whole curriculum developed for them, supported them with therapies, training, even trained their staff members on how to care for these kids' mental wellness. We have also provided trainings to over 300 individuals, both virtually and in person, regarding mental health topics, suicide prevention, anxiety, depression, etc. We have also trained 100+ individuals to become mental health first aiders directly and also through partnerships with other organizations. And we have further also trained actual organizations, other NGOs that provide mental health first aid or counseling, so that, we have also provided training for these organizations, mental health first aid and all of that. Like I mentioned, some of our community outreaches, Oshodi, we had been there to provide mental health awareness. Makoko, we provided free mental health counseling. Unilag, we were there for an outreach, spoke to the students, and then Surulere as well. I had already mentioned our referral service and our mentorship. So this was our Unilag outreach program this year. where we went to the school. We partnered with because we like to work from ground root. So that's why you also see that we do a lot of partnerships and collaboration, because we believe that the mental health space is one where it's only going to thrive, especially in Nigeria, through collaborations and working together. So we worked with the student body of psychology student body in Unilag to also bring this awareness work and all of that. For the Surulere community, as you can see in the pictures, we had a sensitization as well as one-on-one counseling, first aid counseling for individuals who attended. And yeah, like I mentioned, by the way, this year, our biggest project this year had been the support group I mentioned. It's called the How Far support group. How far typically gotten from the Nigerian context of how far, sort of checking in, how are you, what's up? So we've had support groups every single month in this year. This month, we have one solely focused on moms. So if you're a mom, first-time mom of older kids, whatever it is, there is a support group holding at the last Saturday of this month for you, and we just provide a safe space for them, and also a space where they can unwind and talk about whatever challenges they might be experiencing. All our support groups will always have at least 2 to 3 psychologists on ground to further support the attendees. That's the free first aid counseling I had mentioned. So our support groups, we had we have had different support groups from anxiety and depression, which ran for like 6 months only on anxiety and depression, just to support people more. We had support groups on relationships, managing and building healthy relationships. We had support groups on suicide prevention and so many others. All of this just so we can support the average Nigerian and equip them with healthier ways to live their life. I'm trying to rush this as much as possible. I'm so sorry I'm taking so much time. The free mental health first aid counseling, like I said, it's something that anywhere you are in the world, you can literally reach any of our counselors. You can either send us a DM on social media or get the link via any of the links, via the link in any of our social media handles. So just like that, fill the form and a counselor is assigned to you. At least now we have said within 48 hours, simply because we usually have like an influx, and that makes it a bit difficult for a counselor to reach out within 24 hours. So this was our last year project Love Home that I mentioned, where we went to the orphanage. These were some of the evidence pictures and things like that. So I think I'll just end this right here, right now, so that I can take questions and anything else. I can take questions or, whatever it is, anything else, but this is just a brief overview. You can find PsychBabble on all social media platforms as PsychBabble NG. I'm going to put that in the chat box. Thank you. I need to catch my breath.
Thank you so much, guys. We need to have a round of applause in the comment section. I know, come on. Amazing work. I think it's really amazing when we have people who are truly making contributions into society, especially for our wonderful, amazing, and I'm giving affirmations, positive country, Nigeria. So without further ado, we're going to, does anybody have any questions for her? Please do ask any questions at all. Okay, so I see one question. Are you noticing any hurdles or pushback from the community? So I'm guessing she's referring to like the communities that you help. Do you notice any pushback from these communities or hurdles?
Okay, so I would say yes, because some people actually, so we get this thing where because everybody who uses our free counseling program, for example, we always like to get like a feedback, just so we're able to measure what we're doing and, the impact that we're having. One of the constant feedback that I always get, even from the counselors themselves, is, I don't think this person is serious. And sometimes when you look at that person that the counselor may have said is not serious, when you look at their feedback of the counselor or of the session, it's always like, I did not think you people were real. I did not think I would, be able to chat with someone just for free. So I just wanted to test it out and see if it was actually true. So there is that. And then there's also some people who would be like, oh, I'm reaching out for a friend and I want to fill the form. So you reach out to the friend. And I'm like, it doesn't work that way. You can't force them to get help, you know? So, but a lot of the times, the people who, all 2,000 plus people who have used our platform so far, whether even the ones who were not serious about it, have always picked something out. It's always, oh my God, I didn't think this was possible, that this has been amazing. I've gained clarity, I've done this, I've done that, and things like that. So it's been an amazing journey. But again, just like you said, it's the African Nigerian society. So that there is usually, you know, a bit of a pushback here and there. I saw another question just now.
Okay. They asked,
Hold
how
on.
long has the foundation been in existence and how is it funded?
Okay, so unfortunately, we are still self-funded at this time. We're still self-funded. We are looking for fundings as much as possible, but we are still self-funded, which is why I'm always so thankful for my volunteers as well, who are always willing to, you know, come out and do these things. But we're still self-funded, and we've been in existence since December 2019. So we've been, prior to that, like we've been in existence for a couple of, I think 1 year, 2 years before that, but it was officially registered as a not-for-profit in Nigeria in December 2019. So, and our first event was in February 2020, just before everywhere went locked. But yeah, so yeah, we are always open to collaborations. We're always open to funding, by the way. So yes, thank you.
Yes, great, great, definitely. And I would not say, unfortunately, it's amazing that you guys are even able to still be up and running with the donations that come in. So that's amazing. I guess this is a comment and a question. Amazing work. Love what you're doing on your page. Still on the topic of pushback. I'm curious, understanding that there are different cultures in Nigeria and some aren't exactly receptive with these innovative vehicles. How do you implement cultural where did I just lost? Oh, how do you implement cultural? Why do I keep missing? Okay, I'm gonna start back up. And
Cultural
some
competency.
no, I keep missing the line. Oh, sorry. Okay.
Okay.
And some aren't exactly receptive with these innovative vehicles. I think he's basically just asking the same question because I keep missing it. I think he's basically asking the same
Yeah.
question in regards to what are
So
your
they are
like
asking,
practical
how do
steps.
you implement? So yeah, so their
Yes.
question is, how do you implement cultural competency in your support group or other services rendered? So one of the things we always do is, for example, I usually lead some of the trainings that we have for our volunteers, for even our support groups, our support group facilitators. I always keep them informed. I'm like, please remember that there are some of these people who may not understand 100% the terminologies you might use, seeing that you're a professional. So break it all the way down, even use our typical everyday to-day experiences, because again, our psychologists here are also Nigerians who are living in Nigeria, and particularly in Lagos, because living in Lagos is another thing entirely, right? For the community outreaches, what we like to do is every time we go on a community outreach, we look at the audience, and like the one we did in Surulere, for example, almost 80 something percent of the attendees were older people who were not able to 100% speak English. So one of our volunteers who was very fluent in Yoruba, which is their language, was able to actually deliver our sensitization program in Yoruba language. So that was amazing. And then even the counselors, so every time there was someone who wanted to speak with a counselor one-on-one at the community outreach, if you can't speak English, we'll direct you to another counselor who can speak Yoruba, so you are able to communicate properly with them. But yes, all our counselors, like I said, our counselors are not just people, anybody. So as much as we want to support everyone, as much as we want to also mentor as many young people, one of the other things we like to do with our counselors is you have to be in the field, like. So psychology graduates, graduates of social work, graduates of guidance and counseling. So people in that area, before they then further receive, further training from us on how we operate. So yes. Yeah.
Yes.
Thank you, Erioma.
Yes, that's amazing. I think just to also, I think these questions are very spot on because even when you mentioned places like Makoko and things like that. Just going into spaces like that, a lot of there is that language barrier, not even only like cultural languages, but maybe even just going there and they're like, this one just speaking grammar. Do you get? But having that and ensuring that those communications are being communicated, it's amazing. So thank you so much. Any other questions before we move on to our second speaker? Okay, one more question we have. Can you speak about the social stigma attached to psychological interventions in your area?
I have to read that. Sorry, 1 second.
Okay.
Okay, can you speak about the social stigma attached to psych? Okay, I mean 100%. So anybody who I see a lot of Nigerian names on this call, so I'm sure that we all have a little bit of an idea, but it's a typical thing. So one that I always see that plays a huge role is I remember even a colleague who is also in the medical profession, yes, not in the mental health profession, but they had recently relocated out of Nigeria and they were really struggling. And someone had asked them, why don't you, I know a therapist here, why don't you actually, just go check in? And she looked at her, I was like, I'm Nigerian. Like, that was her response. As per like, I'm a strong Black independent woman. We don't do this. And she called me. I remember us speaking, and I was like, do you know that this is the same issue that you face even as a medical doctor? You see typical Nigerians here who would say, instead of going to the hospital to actually get medications or get treated for something, they're like, oh, you know what, I'm just going to take the mixtures that they do because that's what I know to work. So, but here, I think regarding the mental health space, is always also that thing that it's not really our issue. It doesn't happen. So every time I try to give them real life examples, even if you go to our website, you would see warrior stories. Those ones, they are there for a reason. And I like to collect these stories every now and again because I think it helps the average person, even the educated one, to realize that these things are not far-fetched. Like, they are right under your nose. They are happening to your neighbor. They are happening to your friend, and it could happen to you. So when I bring these stories and they actually see the real stories written by these people themselves, or the only thing is just that it's posted on our website or on our social media, it's just, I see the thing on their face. You can see it, we're like, huh, okay. So that has always been an issue. That stigma has always been an issue. So a thing of a family member has a problem or has a mental health challenge, and everybody's like, shh, don't talk about it outside, and they try to hide away that family member. But bringing out these conversations, having them in grassroots environments, it just, even though you're going to be hush about it, you are still able to maybe discuss it with one friend that, oh, do you know that they said mental health issues is not affecting almost everyone? You have it, even if it's like a joke conversation, but you are having those conversations, right? So that's why we like to do these things in smaller. We even, earlier this year, we had gone to a private family function in Ikoyi, where they had invited us to come speak to their family members, that's friends and family, because they had lost a relative to suicide a couple of years ago. So they were marking their remembrance, and they decided, you know what, it would be a good idea to actually talk about this issue as well. So even though we didn't go all, oh, suicide is this, suicide, we had conversations. And you could see that these are the elite people in Nigeria, but you could still see that they were not willing to have this much conversation. But from, oh, okay, how many mental health, we played games, whatever it was, just to drive that message home that even if you don't want to have this conversation in a full environment, you are going to live here and it's going to stick in your head, and you're able to have this conversation with a friend. And then when you actually need a therapist or need mental health support, you know where to go, you know who to help, So that's just, I hope I answered that question. I really hope I did.
Yes, you did. Thank you so much, Sandra. That was amazing. I know you guys loved her, so definitely let's get some excitement in the chat box, letting her know how much we love what she does and we love what she said. Thank you so much. So we're going to introduce a second speaker, Mr. Thank God Ochecho. Sorry, every time that goes up, I lose my notes. Okay, Mr. Thank God Ochecho is a dynamic, hardworking, passionate man with a creative and innovative mind. a graduate of psychology from the Redeemers University with a master's. I'm a little bit biased with that Redeemers University, just a little bit. From the Redeemers University with a master's degree in development psychology from Lancaster University, United Kingdom. Thank God Ochecho has more than 12 years experience in research, mental health, psychosocial support, preventing violent extremists, gender-based violence, and development program management. He's currently working with NEAM Foundation as the head of psychology and training, and the head of psychology and training department. His bio is very, very long. He has so many other things that he's been involved with. He's creative. He has created and designed creative trauma healing programs for survivors of war, gender-based violence, and other forms of conflicts for over 100,000 survivors in more than 75 communities in the Northeast, Northwest, and North Central of Nigeria. He has worked with amazing organizations such as the United Nations Children's Fund, the government of Netherlands, UN Women. He has worked with so many others, Chibok Project, the list goes on. He is fantastic. So without further ado, I would love to welcome Mr. Thank God Ochecho.
Good morning, good evening, good afternoon, everyone, wherever you are listening from. Thank you very much for giving me this opportunity to share my thoughts on the work we do at NAME Foundation. I sincerely want to appreciate you for the great work that you're also doing. And I also want to thank Sandra for that wonderful presentation and what they are doing in the organization. I just have one assignment, and I'm just going to try to be brief because I have a lot to say, but I'll just try to be brief just to share my thoughts at what we do concerning what we do at NAME Foundation. Once again, I want to say thank you to the host and for inviting me. My name is Thank God Ochecho, not Ochecho. I held the Psychology and Training Department of NAME Foundation. So I've been given the opportunity just to talk about what we do at NAME Foundation. So NAME Foundation is a crisis response organization that was founded in 2016, basically in response to the crisis in the Northeast. That's the Boko Haram insurgency. That was what the main reason why NAME Foundation was founded, even though we have expanded beyond that. But we decided to respond to the crisis, especially in the area of mental health. We don't do only mental health, but mental health is one of the core activities of core program that we do at NAME Foundation. And at NAME Foundation, we also provide other services like educational services, gender-based violence, peace building, and so on and so forth. But specifically on the issue of mental health, our vision at NAME Foundation is basically just to build a tolerant, resilient, and peaceful society. And our mission is to fundamentally achieve global peace through social cohesion and improving psychological well-being of individuals. Now, NAME Foundation, like I mentioned, was founded in 2016, and since 2016, we've been providing services to individuals that have been affected by different forms of conflict, especially the violent conflict in the Northeast, the one that moved to, that's the Boko Haram conflict in the Northeast, the farmer elder crisis and the boundary activities in the Northwest and Middle Belt, and also different forms of conflicts that are cut across the different regions in Nigeria. So we've been responding in terms of providing psychosocial support, mental health services to these people that have been affected. And one of the things that we also realize, and which some of us is also aware about, is the fact that in this climate and environment that we live in, one of the things that we say about mental health, we see it as a religious crisis and not a public health crisis. So most time when people are having mental health issues, they try to easily move to receive help maybe from their pastors or their imam or traditional healers because they see it most likely as a religious crisis. But evidence-based, we've tried to provide different services to individuals, and mostly, like I mentioned earlier, we started providing this service because our core focus is the conflict zones where people that have been affected by violence crisis. And I'm going to be sharing with us some of the things that we've done so far and the activities that we provided. But there are two core areas that we focus on regarding when it comes to mental mental health and psychological support. The first aspect is the preventive approach that we take, and the second is the responsive approach. So the preventive approach in our services is the fact that we focus a lot on creating awareness about mental health problem, because when you get to this community, you find that quite a lot of them see there are so much stigma associated with mental health problem. So we try to create a lot of awareness, telling people about mental health issues, why people need to become aware about these, the implications and the effect that it has created, and why people need to begin to talk about mental health, why we need to begin to normalize this thing in our communities. So we create a lot of awareness. Apart from awareness, we've also found out that there's a gap, because people who provide mental health services, and not just mental health services, people who work especially in communities that have been affected by conflict in Nigeria, most of them don't take care of themselves. I'm talking about frontline responders, talking about community-based organizations, civil society organizations. Most of them don't pay attention to their health. So as an organization, we also tend to respond in that direction by providing self-care and stress management sessions for individuals, because we found out that quite a number of them were experiencing what we call vicarious trauma. So vicarious trauma is also known as secondary trauma, when you are not the one that is directly affected, but as a result of providing services to individuals that have been directly affected, you realize that you also begin to get overwhelmed. You are becoming depressed as a result of the story you are listening to, the things you are seeing in the field level. So we decided to respond as an organization to see how do we help such individuals, such frontline responders, healthcare workers, social workers who are experiencing any form of vicarious trauma. But even before responding to those experiencing vicarious trauma, we also try to create that preventive approach by trying to provide self-care skills, self-care practices to such individuals, helping them to manage their stress, because quite a lot of them, especially when you work in this field, the work is quite demanding, the workload, some of them experience burnout. But before we get to the point where they start experiencing burnout, what are the things that you need to do? So we try to create sessions for that, and we do a lot of capacity building. I'm going to come down to specific projects that we've done, but I just want to give a general overview of the things we've been doing over for the past 6 to 7 years that we've started. So to talk about capacity building for community-based organization, capacity building for civil society organization, for community stakeholders, for corporate organization, on issues that has to do with mental health. So for the responsive approach, now, what we do basically is to provide therapy, psychotherapy for people that have been affected by conflict, people that have been affected by any form of conflict or traumatic experience at all. Maybe it's has to do with gender-based violence, it has to do with Boko Haram crisis, the Farmer Elder crisis, and so on and so forth. So we try to provide these services to them because some of them that have been affected experience psychological trauma, and when they experience psychological trauma like that, it impacts on them, and there's a need for that. So I will share 2 stories with you based on practical reality, and to see why the need for us to do a lot in this space when it comes to trauma. Yeah, different organizations are doing quite a lot. They are trying their best, but I think there's much more to do, because the demand of trauma care outweighs the capacity that are available. And it's important for us to be able to see that we need to provide these services. My first story had to do with a young boy that we're working with in Borno State. And this young guy, when we start providing counseling to him, this guy is not less than, I think it's no more than 9 years old, yes, specifically 9 years old. So when we're providing psychosocial support service to him, and one of the things he told us is the fact that, we saw him, he was contributing money, saving money in, there's this thing we call Kolo in Nigeria, just a saving box. So he was putting his money inside it. And we asked, why are you doing this? That is quite a good initiative. He said, no, I'm saving this money because I want to gather enough money to buy gun and kill those that kill my father and my mother. Now, that was basically his own experience. It was grief. It was experiencing trauma. It was that vengeance was already there, and the only mission he has on this earth is for him to just gather money and buy gun and kill those that kill his father and the mother. Another story of a young boy, again, we asked him, what do you want to do when you grow up and when we're providing all of this service? And he said that, when you grow up, you want to be a soldier. That's a noble profession. Why do you want to be a soldier? He said, I want to be a soldier because I want to kill all those that killed my family. Now, soldier it's a noble profession, but the intention, the objective, why you want to become a soldier was very wrong because of the trauma that he's gone through. Now we have a personnel that worked with one of the INGO, I don't want to mention the name, was going to Bama. Bama is a local government in Borno State. He was going to Bama to monitor the activities that they are doing in that local government. And unfortunately, they were attacked by Boko Haram. But because he was in a bulletproof car, God helped him. He escaped, that experience. But there were some people that were killed, and he saw it live. And when he came back to the office, they told him that you need to see a therapist. He said, "Oh, why do I need to see a therapist? That is not important." The next day when he was taking his bath, immediately the flashback of that experience came to his mind, and he ran out of the bathroom and picked up his phone and called the office that he need to see a counselor. Now, why am I sharing all of this story? To tell us that impact, people go through trauma, people go through psychological issues, they are experiencing trauma as they work in the field, and those who have been affected by this crisis. So in our organization, we have different projects that we have run, that we have conducted, and those that we are still doing at the moment. The first one, I'm just going to share a few and I will round up. The first one is what we tag as counseling on wheel. Counseling on Wheel is one of our flagship programs that has been recognized globally by United Nations. And that program was able to reach over 100,000 beneficiaries, that is survivors of insurgency in Borno State alone, across over 50 communities in that state. And what we did is that the program is designed in a way where we use tricycle, if you know, called keke nape, for those that are used to those that live in Nigeria. What we call keke nape, tricycle. We go to this community. We call it hard to reach community where people find it difficult to go to. Our counselors that will train, they go into this community that have been destroyed or that have been affected by the Boko Haram crisis. Because once there is crisis, people destroy, their livelihoods have been destroyed, and their loved ones have been killed. Some families have been displaced, but there are people who are experiencing psychological trauma. Before you start thinking of rebuilding a community, you need to help these people. Even before you start telling them to go back to their business, they need to be stable emotionally. So we go into this community, we provide counseling services to these individuals in their community, taking mental health care to their community, making it accessible to them and also affordable. We don't charge because it's an NGO. So we go into this community, we provide a service to this individual. So we're able, over the years, because the project spanned for like 3 years, and we're able to reach over 100,000 survivors of insurgency. And like I mentioned, it has been launched in the United States, that particular model that we use to be able to provide this service. And one of the things we also did was to integrate mental health into peace building, because we're holding different community and peace meetings with the community stakeholder, trying to ensure that there is peace. Before you talk about peace in the community, people need to be emotionally stable. Like I mentioned earlier, people are already aggrieved, people are already, that vengeance is already there. People are angry because of the things that they have experienced. So before even telling them, oh, you need to have peace and all of that, you also need to provide mental health care to such individuals. Another project that we did is known as the Resilient Project, funded by European Union and French Embassy. And by the way, the Flash program I mentioned about was funded by Dutch government. And the reason why that program, this second program is so unique, which is known as Resilient, is the fact that there are 3 major components. The first one is mental health services. The second is what we call problem management plus, using the methodology that was defined by WHO to be able to provide this service to them. And the third was psychological first aid training. There's the need for psychological first aid training to stakeholders in the community, because most of the things we do are community-based, using community approach to be able to reach out to people who have been affected by any form of conflict within their community. So provide psychological first aid to community stakeholders so that they have an understanding of what it is in the event of any form of attack. They can be able to respond to this issue in their community. So that program itself was able to reach up to 5,000 survivors of insurgency in their community. And we also provide the PFA training we provide for over 400 stakeholders, community stakeholders like traditional leaders, youth leaders, women leaders, religious leaders within the community. And that was a program that we were able to run for 2 years, and it was conducted successfully. The third project is known as iMerit. iMerit is a program that we focus basically in Katsina State and Zamfara, and it's for, if you remember, the boys that were kidnapped, the Kankara boys that were kidnapped some years back. in those states. So we're able to provide support funded by UNICEF, able to provide support to these individuals to ensure that they are able to go through our counseling services, provide expressive therapy services to them. And I'm going to round up by talking about our methodology. That's when I will emphasize this part of expressive therapy that I'm talking about. But we did that for young children who have been affected or who were kidnapped and were released. But if you have been kidnapped and released, trust me, there's a lot of trauma that you will definitely experience. So we're able to provide such services to them. The fourth program that we have engaged, I'm just talking about the program we've done that has to do with mental health, is what we know as called Healing Through Expression, funded by United Nations Fund Population, that UNFPA. So Healing Through Expression is a program that was specifically designed for people, women and girls that have experienced gender-based violence. So they look at it that it's not enough for you to provide livelihood support, it's not enough for you to provide shelter, it's not enough for you to provide vocational skill for these women. There's the need for you to provide mental health services. So we went there, we provide mental health services to over 5,000 women who have been affected by gender-based violence. We call it Healing Through Expression. But one of the uniqueness and the methodology of this approach is the fact that it's very difficult for women to be able to tell you and open up to tell you about the gender-based violence issues that they have experienced, whether it has to do with sexual abuse or whatever form of abuse. But the methodology we tend to approach, we know that, counseling alone will not be effective in this instance. So we adopt expressive form of therapy known as psychodrama. So we use psychodrama as a methodology to be able to target these women. Psychodrama is just, using drama to facilitate healing and growth. So exposing them, allowing them to act, and in the process, they are sharing their experience, talking about designing the script themselves, talking about what they've gone through and all of that. So we were able to do that. And the fourth project is known as the Chibok project. Now, the Chibok project is unique because this project only focuses on expressive therapy. Just go into community in Borno State that have been affected by people in community that have been affected by insurgency, provide expressive therapy. So we did psychodrama, we did music therapy, we did dance therapy, we did art therapy for both children, women, and girls in those communities, and even men. And one of the things we always adopt is what we call mindfulness techniques. Mindfulness techniques, one of the things we do is to localize it. Localize our mindfulness techniques by, for instance, in Maiduguri, in Borno State, one of the things that they are used to is, if they use ant farm. So we allow them to knit the ant farm by themselves. This outside cap, if you know it very well, we allow them to knit the outside cap by themselves. Now, the knitting itself is not a vocational skill we are teaching. We are teaching them the ability to understand and develop mindfulness techniques. So the more they focus their thought in the present moment, the more it also helps them to be able to facilitate healing and growth in the process. So we've done that, and it was very, very, fantastic. The fifth project, as I begin to round up, I have more to say, but because there's no time, I won't focus more on that. So the fifth project is the Mind Care project, which we just started this year. This project is funded by MacArthur Foundation, and the focus of this project is to provide mental health services to civil-based organization, or civil society organization rather. So what we are doing is that we're working with civil society organizations, because we know a lot of them, they are doing quite a lot of civil organizations in Nigeria, but who take care of their mental health. So we proposed this to MacArthur, and we're funded to do that. We've started the program providing self-care services to civil society organization, providing stress management sessions to civil society organization, providing psychotherapy to civil society organization. And the last but not the least is the fact that we've also developed a program that is known as lay counseling program. There are a lot of people that are not trained psychologists, but they want to provide counseling to people because we need more people. A lot of people are going through trauma. So one of the things we decided to do is to train people in lay counseling. Those that are interested, we train them across board in different communities so that they can respond at least at the basic level that has to do with any basic mental health issues, so that when there's difficulty, they can make referral to different organizations. As a roundup, the methodology that we use in every of our approach is the fact that we use, first of all, is advocacy. You don't go into any community without adopting advocacy. You get into the community, get the buy-in of the community stakeholders, psychoeducate them, ensure that they understand the program. And then, because we want our service to be evidence-based, that's why we have data. We've collected a lot of data that we've used for research. Our services is evidence-based. So the first thing we do is to do pre-assessment. We have different psychometric tools that we use to assess. You want to know if this person, the fact that somebody has gone through expressed conflict does not mean the person is traumatized. So you need to do a pre-assessment to assess them and be sure that they are traumatized. Then we design our intervention based on the outcome of our pre-assessment. So we use counseling. In counseling, we use narrative therapy and so on and so forth. We do expressive therapy. We are very big at that, because especially for children, most time you can't just be counseling children. They might not know how to express their trauma. So you engage them in art therapy, in music therapy, in dance therapy, and so on and so forth. And afterward, we conclude by doing post-assessment. You need to do post-assessment so that you can compare to see the impact of your intervention. And then we do set up support group. We don't just leave the community like that. We set up support groups so that they can be meeting on their own and sharing different experiences. And for us at that level, we also do follow and so on and so forth. Because of time, I would like to stop here. There are quite a lot to say, but because of time, I would just like to stop here. And once again, thank you for the opportunity.
Thank you so much. Thank God. That was amazing. I mean, the comment section is already bubbling. So thank you so much. And I think one of the things that really stand out to me, aside from all the amazing work, is the fact that you mentioned something about how, these communities, we can come in and give them vocational training, all these things, but they actually need these mental health assessments and programs, because when this trauma is not dealt with, yeah, you're teaching somebody vocational skills, but they still have so much that they also need help with. So this is amazing, because your guys' work, it definitely helps other organizations as well to work easier, because then when they come in with these trainings or these different information, it's more receptive because your mind is clear. And I think that's amazing. So we do have a question. I don't know if you want to answer any questions, but the one question that we have right here is, do the patients come to you, or do you go into the communities or schools? And it seems like an incredible amount to manage. Bravo. So basically what he's asking is, how do you guys go about getting people? Mr. Thingo, I don't know if you want to answer that question.
Okay, thank you very much. Like I mentioned, there are different approaches that we use. The first one is because we are an NGO, so we get quite a number of funding from different international organizations. So, and this organization, they're interested in crisis area. So in crisis area, communities that have been affected by crisis. So we get a lot of people. In fact, because it's an emergency, most time we don't even, because it's budget constrained, we don't even reach out to as many people that really want the services, but at least we also reach out to the number of people that we can reach out to. So for at that level, we go into the communities, that have been affected by crisis. We do what I call community advocacy. We gather the people together, we'll provide our counseling and our expressive therapy services to such individuals. So it's easy for us to get into those communities because we already have the available fund. We are not collecting money from them. All the services are free, you understand? So we get into those communities. It's easier for us to get that. We also have the one that the service that we provide in Abuja here is known as Sanctuary, our Sanctuary, where that is a paid service, but at a subsidized rate, where we provide psychotherapy. This one is a clinical setting where we are able to, provide in-depth services, clinical psychotherapy to individuals that have been affected by whatever traumatic event. This is not an emergency setting. This is a clinical setting based in Abuja. The service is known as Sanctuary. So we do that. So basically that's how, and we get people subscribed to those services, on our platform. If we go to the website, you see NIM Foundation Sanctuary or NIM Sanctuary. You will see there is there. And also NIM Foundation, you see quite a lot of work that we've been doing. But it's easy for us, especially when people are not paying for the service, it's easy for them, to come to receive our services. And because we also try to create that awareness before we even provide the service to them. So quite a lot of them understand that this is important to them. I don't know if I'm able to answer your question.
Yes, the second question that was also mentioned was, how do you guys, how many employees do you have, or volunteers as well? Do you guys have employees or volunteers?
Oh, okay. If you are talking about employee as an organization, we have over 100 employees, both at the HQ and the field level. But we have quite a lot of volunteers. So for us, so the 100 employees all are not mental health. They are not just providing mental health services. Like I mentioned, we have other services that we provide, like peace building. We have a school in Borno State, and one of the things we do in the school is just strictly for girls who have experienced conflict. You understand? So also the school is free for them, but it's being funded by, an organization. So what we also do again is that we have integrated mental health into education, because we have standby counselors who provide counseling services to those girls, and as well as they are receiving their education, they're also receiving counseling services, So for us, we have employees, different from employees across different states, because we have programs across different states, in Nigeria. So basically, we have over 100 employees, and we have volunteers. There are organizations that we partner with that bring they train them. Like there's this particular organization that train individuals that are interested in lane counseling, but they come to us to come and do practical work, because we have projects in different states that volunteers will come. If you want to learn about counseling, now that you have gotten the knowledge, but you need a place to practice, to just provide counseling, so they come. We have that partnership with that organization, so we bring some of the people that we have trained to come and do practical work with us.
Thank you. Thank you. I have one other question that was asked earlier on, and I actually really love this question as well. So the person is basically, commending you for your work, and then just asking, like, they're worried about our boys as well too. When you talk about gender-based violence, is there anything that is focusing on growing the boys and how to understand how they can understand, like, the problems and violence and things in that sort?
Yeah, thank you very much. That's a wonderful question. Maybe because I was talking basically on mental health and how we provide those services, but we have a separate department in the organization that is known as Department of Gender and Social Cohesion Department, and they are doing a lot of work. They have a lot of projects that has to do with gender-based violence, and one of the things that they also do is the fact that they also engage men and boys. In fact, there's a new project they just started that one of the activities is men and boys engage, which means they'll be doing a lot of work with the boys and girls, creating awareness about issues that are around gender-based violence, the social norms and all of that. So that is not my core area. If not, maybe I would have talked about the things that they are doing with boys, men, around gender-based violence issues.
Thank you so much. Thank you so much, Mr. Thank God. Thank you, thank you, thank you. So we're going to move on to our last speaker for this particular segment, and that is Dr. Valerie Okosi. So Dr. Valerie Okosi is the Senior Registrar in the Department of Pediatrics at the University of Nigeria Teaching Hospital, Enugu. She is from Onitsha in Anambra State, Nigeria. So without further ado, please help me welcome Dr. Valerie.
Thank you. Thank you very much. And thank you guys for having me here. First, I would like to apologize for coming in late, some miscommunication and logistic reasons. Permit me not to on my video. I hope I can continue. Can you hear me?
Yes, yes, of course. Go ahead. Go on.
All right. So I really don't know where coming here, but let me see. Okay, I'm a pediatrician in University of Nigeria Teaching Hospital. So I'm going to be basically talking about my own perspective as regards mental health in kids, and what we see, and the issues or the challenges that we have. Okay, let me try. Yeah. Okay, so the challenges that we have in when it has to do with mental health. Okay, so for mental health issues in Nigeria, it's something that has been stigmatized to the extent that when it's being talked about, like the caregivers that we see when we notice a child that might be suffering from some mental issues, from traumas, would rather not talk about it. And if at all, they will, just like the last speaker said, meanwhile, thank you very much for the last speaker. I really learned a lot, and the projects you guys are doing are really quite enlightening and very needed in our setting here in Nigeria. Okay, so that's said. So they prefer to go to the churches, to their pastors, and they don't want to talk about it. They feel it's something bad. They feel it's something that shouldn't be mentioned. So this is a very big challenge for us, because with that, you don't get to see them. They don't get to seek help in the right places, right? So for us in our practice, the group of people that usually face this kind of issues, and the most common that we see is post-traumatic stress disorder and depression from a lot of trauma that they go through, especially the female gender. So in my course of practice, a lot of them have come in with most commonly children that have been raped by their caregivers or uncles and even parents, So and they tend to go into depression. They withdraw, okay, and then their school performances starts to reduce, and they come in with, the parents come to them, especially because the parents know about them, what is happening, because when they tell them, they feel like it shouldn't be talked about, and they don't seek care. But because when the child starts doing badly in school or start complaining of some funny things, they now come to us and they present with no particular symptom. So they just present with vague symptoms like she's always sleeping in class, he's not doing well in school, or he's always having fever, or he's having abdominal pain. Or for example, the child will just be complaining of a particular thing, but when you test it, there's nothing. So, but we have this clinic that is basically brought out for them, whereby we call it adolescent clinic, but it's usually for children like this that are going through a lot of trauma and depression, but the caregivers are not open to talk about it. So when you now talk to them and tell them, maybe we usually tell the caregivers to stay away. That's when they now open up to us and then tell us maybe what they've gone through, or usually it's a continuous process whereby it's either the uncle in the house or something like that has been traumatizing them, and because of that, they go through a lot of depression and all that, and they are not being talked about. So the major issue we're actually having is the fact that people think that mental issue is just when somebody removes their clothes and goes out the streets. But mental issues can be minor things like, depression, which they see as it shouldn't be, that they should pray about it, and then everything is fine. And they don't seek proper care and then proper therapy. They don't go to see the therapist for that. So because of that, we usually have those adolescent clinic that are stipulated for that. And then also we do a lot of campaign or awareness, creating awareness to see that this is a problem. And if you notice such, you should visit the hospital to be directed accordingly to who to see, so that the situation could be handled. And then there are also other measures for the case of the rape, we go through the other I'm talking more of the mental issue aspect, but the other police cases, and then referring them to NGOs that can continue that other aspect. So, I am not involved in any NGO that deals with mental health. I'm not a psychiatrist, so I don't really see much of those. But for my own practice, these are basically the people that we see that have these mental health issues. Then apart from the patients too, in Nigeria generally too, there are some people that go through a lot but are not seeking help for it, maybe because they've not gone to the extreme of schizophrenia, right? So a lot of advocacy needs to be a lot of Okay, so a lot of awareness needs to be created on these mental issues and the different types and the symptoms. Okay, that could arise from such. Okay, so what else do I want to talk about? Even in our workplaces, for example, when people go through loss of a loved one, okay, or maybe even for us, for example, even medical professionals, when they go to an exam and they don't do well, there's a lot of trauma, a lot of stress that we go through, especially in Nigeria, in our own examinations, and then the person is expected to come back to work the following day if the person doesn't do well. So this one is now on the aspect of even caregivers. Like, I'm just trying to say that mental health issues can involve anybody at all, to the extent that somebody that is well dressed, laughing with you and smiling with you, can actually be going through a lot of mental issues, depression, and you don't know. Yes, and then by the time the person is seeing patients and the way the person is conversing with patients and what the person is doing, you just realize that this person is actually not stable, but just has to come back to work because of reduced manpower and the rest of them. So I think what apart from hospital management, people in the organization, like the how do I call it, the administration, the CEOs or whatever, should have mental health assessments from time to time to assess whether this person is actually fit to work in terms of mental health issues. So, because it can affect the product or the output of whatever the person is doing. Okay, so by and large, I'm not going to talk much because I feel, I don't know, I'm just going to talk on my own perspective and what I feel. So generally, the situation in Nigeria as regards mental health is that it's what I say is stigmatized, is not being talked about, and we need to actually remove that stigma and tell people that it's okay to actually go through this and that you can actually seek help. There are therapies for it, like Dr. Tangod have actually said. There are organizations that have tried to come up to help with this kind of situations, right? And then so that they don't go to the prayer houses, which we usually see commonly, and basically they don't probably isolate them from the other children and the rest of them, which is what they do, instead of seeking proper professional help. So I think I'll round up with the fact that what we really need more and most in Nigeria is more of awareness and removing the stigmatization that's intact on mental health issues in Nigeria. Thank you.
Thank you so very much. That was amazing. She ran off on the camera so quickly. I was about to comment again, a beautiful woman again. But thank you so much. I myself even had a question. I once again, like, amazing insights that you've given, especially now from that end of children most specifically. So my question is, I mean, I'm not a mommy, but I have a younger brother that's 7, and we have nannies. We've had several actually. And I think and this is like, of course, transparency. I think one of the fears, at least I'm not a mom, but I feel it, is like, oh, I hope nothing happens to him when I'm not around. Yeah, we have cameras in the house and stuff, but I don't even know the people who come into the house. So what would you say is things that parents in general or older siblings or guardians should look out for when they're trying to know? Because some parents don't really actually know what's going on with their children, or if any of them are facing, what questions do you exactly ask to know if something is happening? I think that's my question, and then we have another question in the chat box as well.
Okay, so to try to one of the signs that something is happening in the house is that the child is withdrawn. And then when we tend to, because usually kids are innocent, really, but when they have been exposed to something they're not meant to, they act differently and a bit, the kind of things that they portray are not what should be for their age. And then when you tend to examine them, they are scared. They are apprehensive. They're so scared, even because usually we tend to, maybe do a vaginal examination for the females, they are so traumatized by that thought. Then you know that something has happened. Okay, and then the withdrawn, like normally, and then whenever the person in question, the person that is been molesting the particular child, whenever the person is talked about, the child is either mute or wants to just not talk about it, or just avoid it, because they usually tell them and threaten them, if you say anything, I'm going to kill you or something. So they are so scared. All right. So that's change in behavior of your child. Your child is not as, as jovial as he used to, and everything. So you need to have known your child, the normal state, to know that slight shift and withdrawn nature of the person. Okay. So whenever, and then in the examination couch, they are usually very, 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 very protective of themselves. And then once the person that is in the culprit comes, the face, I don't know how to put it, but they just see the demeanor on their face changes. Okay, so it's really something that, you need to sit down and talk to your child when you see that child is, and then sometimes, to me, I'm a mom, so I tell when my help is not around, I just ask my child randomly, how are you? How is the person that is taking care of him? Is any problem? Do you feel? I just ask random questions to know whether I can get any sign of maybe he's not happy with the person or something. Or maybe when she goes out and I'll be like, okay, are you happy that Precious is not around? They'll be like, no. Or maybe when the person is actually not happy with that person, be like, yes, I'm happy. Do you want Precious to go? I want her to go. So there's something. So these are the small things that you can actually use to know that, okay, something is wrong. Yeah, because these people really know how to boycott cameras and still do what they want to do. So, but I think the behavior of your child can actually tell you a lot, but you need to be attentive. So that's I think.
Yes,
I don't know that answers your question.
Yes, definitely. And I think it kind of also touches the second question about what are the warning signs to refer a patient. Or do you know, like, I mean, you've kind of mentioned them, but I don't know if you want to touch a little bit more about some warning signs maybe to refer a patient.
Well, at that point in time where they've come to the hospital, and you have to have made the diagnosis that maybe this particular child is suffering from some mental issues by what you've seen already. It's mainly for them. They are withdrawn. They're not talking. They're not maintaining eye contact with you and the rest of them. Yeah. So and then what is cool that they usually go to, so it affects their grades. Maybe they are doing better at this particular. And apart from that, this one is more of rape. Then for these children that are bullied in school and the rest of them, and they don't tend to be so depressed because of that, you also see it in their grades dropping in school and the rest of them. So this kind of person needs a lot of counseling, a lot of self-esteem, improving the person's self-esteem. So at that point in time, well, depending, we don't take to the psychiatrist, but first of all, we take to the adolescent medicine consultant to counsel first, and then if need be, refer to the psychiatrist. That's because when they need medications and the rest of them to help tackle them.
Okay, great. So we have two other questions as well. So one of the questions is, in terms of therapy, what roadblocks are you observing with your patients?
Well, in terms of therapy, when they present, we really don't have much. Our problem, our roadblock basically is present. As let them show up, let us even know that this is happening at all. Okay, but once we get them, we are able to actually take care. But the other thing too is follow up. They might come first one time visit, and they don't come back again because they already told them what's that with mental health. You don't have mental health in Jesus' name. We cancel it in Jesus' name, and then that's it. They don't come back to you again. Okay, so a lot of religious beliefs and cultural beliefs don't believe that we could have such. They just target a disease of the white. Like I've had a lot of people say, this is white people's disease. We don't have such in Jesus' name. But don't target, don't do that kind of. So at that point in time, they don't come back. But some understand you, and when they start seeing results, they actually continue. with their care.
Okay, and then the last question I was asked, and this last question that we'll take is basically, why are parents protective of the offender than their children? So but basically when you mentioned that parents would be quick to, oh, it's Uncle John, and you just keep quiet, everybody should keep quiet. Why is it that parents are more protective of the offender than their children?
To be quite honest, that's still amazing. In fact, I met a patient last week. This child was molested. It's at 8 years of age. I met a child at 14 years, right? So she was telling me, I was just asking, she had some vaginal infection. I was just asking casually, okay, so have you had sex before? She was like, yes. I was like, okay, you have a boyfriend? I was like, no. Okay, so who did it? Like, my uncle at 8 years of age. No, not even 8 years, 6 years. So what did your mom do? They said they didn't do anything. That they asked her, funny things. The story of it is that nothing was done. So I really don't know whether I think it's something that has to do with culture, and then as if they expose it, that the woman will be seen less of a woman. Like, this woman has been tagged, raped, and might not, they will now maybe stigmatize her as being raped. So they don't even want that story to even come out at all. So that the woman will be, I don't know whether they're trying to protect the girl child by not, putting that thing out that the child has been raped. I think that's part of the problem too. So that they don't, so that the child doesn't get stigmatized by that. Because once you raise it up, it might also raise up to the public that she has been raped. So I think that is part of the reason why they just cover it up in-house, and then they don't want to expose it. The culture is not helping, these cases. And then also, we need more NGOs to, take up these cases and fight for situations like this. But yeah, that's basically from my experience with the people I've seen. I think that's maybe why they would want to rather keep it within the family.
Yeah, that's truly heartbreaking. Even just hearing it, it made me just feel all kinds of ways. Thank you so much, Dr. Valerie, for this insight. And definitely, this is a ploy to each and every one of us, and myself included, that are involved in NGOs or anything that can really, but even this coalition as well, too, that can put hands together to be a part of each and every one of these projects that have been mentioned and these causes. So, of course, when we get back from the break, we'll be able to speak to each and every one of our panelists and ask them more questions, and hopefully be able to also maybe get their contact information to know how we can also collaborate, as all of them have mentioned. So we're going to go on a break, okay? And then we'll come back with our panel discussion. I hope you guys are excited, because as I'm here now, I'm just making so many notes, okay? So the break would be about 5 minutes, and then in 5 minutes we'll come back and we would do our panel discussion, and I'm excited. All right, see you guys after the break.
Skimsy, the producer. 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 Purchase your tracks today. Purchase your tracks today.
it's important because it doesn't get the attention that it deserves. A lot of people don't really understand the pain and suffering that people with mental health challenges face. There's a lot of emphasis on physical health, maybe because you can see it and you can understand the pain, because the pain is probably a lot easier to articulate. Governments don't put enough resources in tackling mental health. There's a lot of stigma that's associated with mental health, so people are afraid to talk about it, especially sufferers, because they think that they will be ostracized, people will not understand them, and so it's a disease that's often suffered alone. I think it deserves far more attention than it's getting because the prevalent rates are just getting worse. Currently, we have huge numbers of young people, some really, really young. You have young children from the ages of about 5 and 6 who have severe mental health issues, and they are not enough spaces and places for them to go for help. I'd like to see governments, not just in Nigeria, but around the world, really give this issue the attention that it deserves, to put much more funding, but not only funding. Funding is only one aspect of it. Another aspect is that we don't have enough practitioners. I'd like to see many more colleges of higher education offering courses in mental health, training counselors, training psychologists, so that the people who need the help actually would be able to get the help that they need. Because right now there's an overabundance of people who need help, and there's an underabundance of practitioners who can actually provide that help. So these need to come together.
Okay, great, amazing. Welcome back, everyone. How are we doing? How was the break? I was missing you guys already. I was really sad, but I'm happy that we're back. So we're gonna go straight ahead into our panel session, and it's going to be a very insightful one. As you can see already, we have some amazing speakers, and they're doing amazing things in their work. So this is our opportunity to get even more insight about what they're doing. So we're going to call each and every one of our panelists up: Dr. Valerie, Mrs. Sandra, and Mr. Thank God. They would be our panel speakers today. So if they can turn on their cameras so we can spotlight you guys, that would be amazing. So we're gonna get started. I'm super excited. I keep saying that, but I'm actually excited. So I've read you guys all their amazing bios, and you've heard them speak yourself. So we're just gonna go straight into the questions. So this first question is open to any of the three of you to answer. So the first question is, how does the healthcare landscape and the infrastructure impact the daily lives of Nigerians rather? And I can ask you one more time. How does the healthcare landscape and infrastructure impact the daily lives of Nigerians? And this is open to anyone to answer. Mr. Tengwat, Mrs. Sandra, Dr. Valerie, anybody can answer. Don't be shy. It's okay.
Hi everyone. So Amarachi, if I heard you clearly, I'm sorry my video is not on. I'm trying to sort that out. But your question, if I heard you correctly, is how the healthcare system in Nigeria affects Nigerians?
Basically, like, yeah, so how does the healthcare, this is simple terms, how does the healthcare system, how does it affect the daily lives of Nigerians?
Okay, so again, I'm going to only answer from my own point of view regarding. I'm not a medical doctor, so I'm going to answer in line of mental health and therapy. I know that there was a time, there was a time where I had literally done this quick research of just you walk into any medical or any hospital and ask to see the psychologist, and most of the time the response is that people just looking at you like, okay, you know. Even sometime I had gone in my state, I'm from Delta State, and I had gone to one of the general hospitals, and I was just doing a research anyway, and I had asked, oh, I want to see the psychologist or the psychiatrist, whoever is around, and they're just looking at me like, no, we don't have that. So where I'm going to with this is the fact that it's almost like in our system, from our government point of view, it's the mental health sector is not factored into health. It's not factored into the health system. So you go to hospitals and you ask for, oh, I want to see a nurse, or I want to see a doctor, or I want to see, there are other practitioners that are not factored in, but for how important mental health is, you realize that it's not there. All right. And let alone getting quality mental health care. So I think that our system as a country, or as a country, from the government point of view anyway, or from the government aspect, it's not where it should be. So it's one that does not incorporate 100% the mental wellness part of an individual. So only in some private hospitals you go that actually they stated it that, oh, we have a we have a mental health sector, we have a mental health section, that sort of thing. Otherwise, you just realize that most hospitals, it's not there. And if it's not there, it still comes back to that thing we're talking about. We want mental health to be a normalized conversation. We want people to actually be able to say, oh, I'm struggling with this and I'm going to the hospital to get help for it. But then you go to the hospital and even the nurses there don't even know what a psychologist do in the first place. Right? So imagine going to a primary health care center, which is like one of the most basic of all basic mental health facilities in Nigeria, physical health facilities in Nigeria. So every community is expected to have primary health care centers. And imagine going there and you're asking, oh, do you have anything? Do you have any therapists? Do you have any psychologists? Do you have any mental health first aid? And none of those things. And some of these nurses are genuinely looking at you like, huh, it's like this one is not a Nigerian, So it's very interesting, and it's interesting as well as really sad that this part are not incorporated. And if these people don't, if we don't have it in basic settings like this, or even the nurses, the doctors, they don't know what this service is to start with. Obviously, the other person is going to keep quiet. Imagine you just, I don't know, for some, maybe a woman who, so my mom is a nurse as well. And I remember one time she was telling me how she recently her patient lost her baby. And the next day, the woman was, they had discharged the woman, oh, you're ready to go. And this is my mom. I always use her as an example. And I always tell her, see, from now till eternity, I'm going to continue to use that example for this. Because why would you just let a woman who just lost her baby, her first child, just leave the hospital just like that? Right? Even anything. So whenever I go home to visit, and every mental health material I have, I always forward to her. Please read up, do this. Just sort of how to help in your own little capacity. So all I'm saying is, I don't think it's being factored in from our government point of view. So it becomes more difficult, which is also encouraging the stigma, and it makes it really difficult for people to actually seek help. Yeah, thank you.
Thank you so much. I'm so sorry. My laptop decided that it wanted to like just sleep off. So apologies for that. I was kicked out. So I just want to see it was. So we're just going to go to. Does anybody else want to add on to that, or should we then move on to another question? Does anybody want to add on to that? Maybe we can get the perspective of our Dr. Valerie.
Yeah, okay. Thank you. Yeah, I think the major reason for the primary, most of the psychologists are in the tertiary centers, right? It is a duty for the nurse there to refer you to a tertiary center where you actually get to see the psychologist. That's one. Then secondly, I think why they are also so ignorant about what to do in that situation when somebody comes to them is that they don't come. We don't have patients that just come in and say, I need this, I need a mental health check or something like that, or else they are pure schizophrenics. They are mad. So that's just what we know as mental health issue in this most part of the country. Just the mad ones, the ones that remove their clothes outside and then kind of thing. So the subtle mental issues that are actually more common and are not, most people don't come in for that. So those other government hospital, primary healthcare centers might not have so much of that encounter. And then when they do in a blue moon, they don't even know what to do. But a proper nurse that knows what to do will refer you appropriately. Yeah, that's just why I answered that.
Yes, thank you so much. Thank you so much. So I want to I'll touch on, a few policy questions as well too. So I guess this question goes to Mr. Thingard. What are the most important policy issues you say you would encounter in your field? Especially when trying to make all these great impacts. What are some policy issues that you guys may come across?
Yeah, thank you very much. In terms of policy issues, we've encountered quite a lot because one of the things we found out is in terms of policy around funding. So people don't really take mental, even generally as a country, how many percentage you have for mental health funding, So it's a major problem that we encounter when it comes to policy issues, that people don't really, whether it's policy around, even at the primary healthcare level, you understand, governments don't really put money when it comes to mental health. I think there's quite, not even a lot of focus, but at least significant focus on when it comes to physical health or medical care. When it comes to mental health issues, funding is a major problem. Also, community-based approach when it comes to mental health policies too is also a policy issue, because most time people come in, you say want to provide mental health services. There's no policy around using community-based approach. People just impose, methodology or approaches that are used somewhere else, but not considering the local context in which people are working in. You understand? Because sometimes you come into a community, you want to provide service, you cause more harm to those people than even good, because you don't pay attention to the local context. You are not culturally sensitive, to their needs, to their belief, and to their culture. So that's also a major problem in terms of policy around the services that have been provided when it comes to mental health. Also, there's a policy issue around training of professionals. People just go into community and say they are providing counseling, even though they don't have any expertise in that area. So there's no policy around that to be able to say, okay, what is the basic or the minimum requirement that we need for anyone to be able to provide counseling to individuals who are experiencing any form of traumatic experience. So that's also a major problem, when it comes to policy issues. And lastly, I know there are quite, some others that I've not mentioned, but lastly, even in terms of all the services that I provide, apart from even mental health services, there's no trauma-informed care. So you talk about primary health care center, you talk about medical services, you talk about different forms of services. We don't even talk about integrating trauma-informed care into some of these services that have been provided. So because there's no policy around it. So even in primary health care center, even at our educational system, in different areas. So we don't place so much emphasis on trauma-informed care. So I think there's a need for us to do policy around funding, policy around capacity building of professional, policy around community-based approach when it comes to mental health and psycho support, policy around trauma-informed care, integrating it into our different services. Just to respond to someone asked a question, I don't know if I can quickly respond to that person.
Yeah, sure, go ahead.
Yeah, so the person asks that, how has our experience been when partnering with communities for outreach initiative? Have you encountered any challenge? Yes, so one of the things we do to mitigate the challenge, it's not like there have not been challenges, but one of the things we do to significantly mitigate the challenge is the fact that we do community advocacy. That's the first step. We go into the community, educate them about our services. That alone, as the moment the head of the communities, what we call bulamas in this part of the area we're working, the moment they get and are buying, it has reduced the problem significantly. Again, so we try to educate them about our services, the benefit of the service, so the community, the impact is going to bring it to the community. However, there are issues of maybe people that you want to engage, they are looking at, oh, how much am I going to get from this? So they are demanding a lot from, in terms of financial gains from the service that you want to provide. And also, because our services is purely mental health services, so most time there's the challenge of the community member always want you to give them, food, they are interested in physical need. It's not like we don't give them, water, but that's not basically our focus. We give them light refreshment, but we try to ensure that don't become the focus. But at times it can become a challenge because most of them take that and make it to become the focus of the services that we are providing in the community.
Thank you. Thank you so much. That's so insightful, even to me myself. Thank you so much, Mr. Thank God. I guess I'll just give this question over to Miss Sandra. And then of course, any of you guys can also chime in. But what can people do in the diaspora to advocate for change in general? So at least especially as it pertains to mental health and mental health policy, what can people in the diaspora do?
Okay, so people in the diaspora, do you mean what they can do regarding mental health in Nigeria or in their own local environment?
So yes, in Nigeria, I would also say also primarily for Nigerians in Nigeria, but let's say for Nigerians also in the diaspora as well too, because I mean, we may be in different countries. A lot of us have moved. Some of us that have even grown up there, we still have that upbringing of the, oh, it's mental health, oh, it's depression, oh, it's not anything. You get. So I guess Nigerians overall, but primarily we're talking about what do people in diaspora do for their advocacy for change in general as pertains to this issue?
Okay, so personally for me, one of the first things I always say is you can never go wrong with actually educating yourself on the basics. So something as simple as you even understanding what the mental health situation is around you, around your friends, around. So how many of us, as individuals, your friends come to you and they're like, oh, I'm struggling with, I don't know, maybe PTSD, for example. Do you know what to do next? How do you respond? Even your emotional intelligence. I mean, one thing that I always say here in Nigeria is a lot of times somebody comes to you with a particular issue or try to talk to someone else about something, it becomes a who is suffering the most competition. So you see people go, that's what you're complaining about. If you see my own, it's almost so like that thing they say that change starts with you. I think that's the most basic thing. Just understanding how you can support the people around you. Dr. Valerie had mentioned something earlier, observing your children and watching, knowing the signs when something is happening, you would see it. So a lot of times we also think that our subconscious is not showing or that we're able to mask things enough. I tell my clients in therapy that your subconscious is showing, whether you like it or not. We don't see ourselves. All right. A lot of the times, the people around us are the ones who would most likely even notice a change in you first before you begin to notice it. So if we pay very close attention to ourselves, our body language when someone is talking to us, how we interact, our conversations, just using, deviating a little bit, using the election in Nigeria. Some of us blocked our friends, not because they came up to you and tell you I'm supporting XYZ, simply because you were having a conversation or they were having a conversation with someone else and you heard the way they spoke about certain things and you're like, wow, and we've been friends this long, and you are surprised by how they were responding or how they see these things. Just educating ourselves generally on our own, mental wellness, our own how we react to others. Make yourself a safe space for the people around you. Then get involved. That's the next thing. I'm gonna just get involved. Find organizations around you. Find people around you. Do something for people around you. You don't need to start your own NGO. You don't need to start your own company if you don't want to. There are so many, 1,000,001. Put your mind to it. Lend your skill set and just support people. If it's to support them financially, you can do that. If it's to support manpower wise, you can do that. Just be an advocate in the sense of the word, in the sense of the word of mental health. Be an actual mental health advocate, right? And also, like, again, because I'm always one-on-one conversation, that's who I am. So one thing I always say is, so a friend comes to you still and they're talking about how they're struggling with something and they need help. Yes, you may not be able to help. Yes, you're not a counselor, you're not a therapist, you're not this, you're not that. But are you able to point your friend in the right direction? So do you even have therapists? Do you have contact? Do you have organizations that you can refer them to? Things like that. These are just simple, basic ways that you can, as individuals, this is both for whether you're advocating for mental health in Nigeria or wherever you find yourself. Simple as that. Do your part, make sure you're a safe space, be an advocate, and then get involved as much as you can. Bring your skill sets, bring your thoughts, bring your ideas, and bring this plans that organizations and individuals have, bring it to life. Yeah, I think that's what I would say about that.
No, that's definitely spot on. I really, really love that. Did anybody want to add on? I believe
Yeah,
Mr. Bengals.
let me just add a few points to what Sandra said. I think in specific terms, people in diaspora can do a lot of online campaign. You don't require a lot of money to be able to do that regarding mental health issues, especially in Nigeria. I think they can do a lot of online campaign. Another thing they can also be involved in terms of supporting local initiatives. There are a lot of community-based organizations in Nigeria here that are doing a lot in this aspect. I think one of the ways they can contribute is to support local initiative.
Yes, thank you so much. Wait, was it my network? Oh, it's breaking. Okay, I think we lost him. Okay, well, if he comes back, then we can just quickly, maybe somebody's calling him, Nigerian, MTN, do that. Anyway, but it's fine. So it's fine when he gets back, we can definitely have his points again. But I definitely love everything that has been said, especially because it's a good thing for us to get involved. We've seen the power of the diaspora being a part of a movement, especially during NSARS. We've seen how if we all put our hands, we could really do something impactful. So I guess the last question I'll ask is, because we're running a little bit over time. So the last question I'll ask is one from the audience. And so sorry for everybody that had a question. This is the question I'll take. How do you detach yourself from the many stories and protect yourself from being affected? Do you feel like it plays a role in your personal life, parenting, relationships? Like you hearing these stories, what do you do for yourself? Do you go to therapy? What are your roles? And this is open to Dr. Valerie or Miss Sandra. And if Mr. Bengard comes back, we can also add on. Also just want to make one more point as well too. Just quickly slide it in. There was mention about the being a support with funding. This is an organization that you can definitely support with funding, because of course this is something that you want to support, so that so much more of these conversations can be had. So if you look at the chat box, you see forms that you can click and fill out alongside with where you can even rewatch this exact recording and past recordings. But once again, for the question, just one more time, because I think maybe, basic question is, how do you protect yourself? How do you detach from these stories that you hear, see? What are your ways of protecting yourself, and how does this affect your personal life? Anybody can answer.
Dr. Valerie, do you want to go? Okay. All right. So I'm thinking they're asking this personally as me, not for themselves.
Yes.
So I'll just answer as me. So I do a lot of work actually. I run the NGO. I also have a 9 to 5. I teach psychology, and I do so many other things in between. But one thing that you will not take away from me is always watching at least one episode of my favorite K drama every night. one episode of my favorite K-drama every night because I love K-drama so much, and it's one way that I, tend to de-stress. And plus, K-dramas are usually soft and easy, so I don't want to watch anything else that is hard. But yes, there is that. I am always thankful for my community, my friends, and my family. They literally hold me down on hard days. And the other thing that I'm going to say is yes, I do have my own therapist who I process other things with in my own life that are happening. So I do have my therapist who I process things with. So yeah, I hope that helps. And oh yeah, I have my at least 7 hours of sleep every night. Nothing can take that away from me. It won't work. I will sleep. But yeah.
Okay. Let me just, I said, not add to that, but say, well, why I found it difficult answering these questions. I actually don't know how I do it, but I compartmentalize in terms of once I'm out of the hospital gate, I'm out. I don't take work home, right? So what I do at hospital, I give them all myself and everything. But when I'm out, I'm out. I try not to get emotionally attached to anybody. I just consciously don't do that so that it doesn't go home with me and affect my food at home, my kids and everything. So I thought myself, work is work, home is home. I do all I have to do. I see a whole lot, right? But if I start allowing it to get to me, I'll probably be a cranky human being at every point in time in my life. So I try to just block it all off once I'm out and just say, okay, this is work, this is just what you do. And then when you're home, you face home. So I don't know, I just compartmentalize it, and then I think it's been working fine for me. I try not to get emotionally attached at all.
Yes, and I think what you both have said is so spot on. I've even taken notes and I would be looking for my own therapies very soon. Because I think it's very easy to, especially in like this social development and mental health world, it's very easy for you to get so involved in what you're doing and forget about yourself. So that's an amazing question and definitely amazing answers. I don't know if Mr. Thank God is back and wants to add on to his point, or if that was pretty much what you wanted to say.
Sorry, I think personally for me, I because of the kind of work I do, trust me, it's quite difficult for me not to sometimes take work home. So I just try to ensure I have two little babies, twins that I play with just to have fun. That's one of the way I distress. Just play with them, have fun, laugh. And because again, I'm a child psychologist, so it's interesting seeing the behaviors that make you laugh, discoveries and all of that. And again, I have support system. I have friends that we gist, we laugh. Anytime I'm tired, we just come have a conversation that's just make us laugh, discourse. So, and I go to the spa. That also just helped me, in a way to just to distress. I think basically that was I. And one of the things I've trained my mind not to, sometimes, just permit me to say this, sometimes one of the things that make people stress is not necessarily the external demand. Sometimes it's internal, how you interpret situations, how you see things. So I've trained my mind to see things differently, not to mean anything to me except the interpretation I give to it. So I just train my mind to interpret things in the way that will not cause me to become stressed. And lastly, every psychologist needs a psychologist, so a psychologist I see sometime. That's all.
Oh, that's amazing. That's amazing. I think this is the answers are a clear human description of you're teaching what you're doing. And I love that. So thank you to each and every one of our speakers. Thank you to each and every one of you guys that have shared such amazing insights and honestly have just really given me so I wrote things down. I'm going to be making sure I go to the movies, making sure I go to spa, making sure I'm watching a K drama every night. I will start today. So thank you so much. And once again, thank you so much, Dami and Dr. Mercedes for this opportunity to even be a host as well too. My name remains Amarachi Kokoro, and it was a pleasure hosting with you guys this evening. So I'll just introduce our conveners and they would give the closing remarks.
Yes, thank you to all our audience and our wonderful speakers. I think we learned a lot from different perspectives in terms of the one-on-one care that people can get, the care for crisis situations that are involved with larger communities and when larger policy issues are at stake, and then also how mental health care integrates with primary care, and how that can be another point of impacting policies so that people are reached in all different ways that they might present to our healthcare system and the challenges that are and stigmas that we still face. So we will have ongoing events. As you saw in the chat, you can feel free to let us know if you'd like to be a participant in our future initiatives. You can watch our this video and previous recordings on our YouTube channel. Feel free to donate, to let others know, to share and donate to our cause. And then Damiola also has a surprising announcement for us.
Oh, do I now? Yes, I do.
Yeah.
All right. So just stick with us for a couple of minutes and we will round up. Again, just really want to appreciate everybody for coming. And I just want to highlight that, I know this year it seems like the focus is really like, back home in Nigeria. And I hope for those of us who are based anywhere else abroad, we're not detaching ourselves, right? It's not only about what's going on in Nigeria. This is really for Nigerians all across the world. So as we're thinking about some of the issues that are going on back home, a lot of those, are happening to some extent here, right? And even, we still have families back home. So whatever impacts them, God forbid, I'm always thinking, God forbid someone gets kidnapped. It's not going to be just in Nigeria, right? You're also impacted by that, just like NSARS was, which is what this organization was kind of birthed out of, because I was looking at the Instagram posts and I'm like, a lot of us still have to go back to school. We have to go back to work the next day. However, back home people are bleeding. And so whatever affects them also affects us. So I hope this is not a, just looking at what's going on there, but we're seeing the applications to us as well. So really want to appreciate our panelists and all of the amazing work that they are doing. Collaboration is a huge part of what we want to encourage here at the Coalition for the Advancement of Nigerian Mental Health. We're all advancing our mental health together. So we don't do that work alone. And just want to share a couple of things. So our website is live of sorts. So that is the big news. We have been spending a lot of time going back and forth on this. And yes, you can just create a website, but part of what our goal is really to create a space, right, for us to continue these conversations. So somewhere in the future, there will be a forum on there, right, where you can ask anonymous questions, Nigerian clinical, specialists or anything like that, they'll also be on just to like chime in, right? So it's just to keep the conversation going and to have a space for people to go back to. We are planning to have a directory from, again, all across the world. So if you're a practitioner here, an advocate, or you're just involved in the mental health space to some extent, please share your contact information, because we hope to create this directory, curated of Nigerian practitioners for Nigerians, because we know that when you see someone of your own background, even though not all of us want to open up to people of our background, just because that's a different conversation, but research does show that people are more receptive, right? When we're talking about communities and all of that, we're the ones that can go to our own community. I strongly believe that. So I think this is part of that effort. It's just to create that directory as a space. So this is still developing and all of that. Watch that space. You can go ahead and, look for more information about future events and all of that. And we have a lot of volunteering roles as well. Feel free to reach out to us. We are planning to reach and hit a lot of different things, whether that's, support groups, whether it is, research, grants funding, all of that. I know there are writers here. someone who was a movie maker reached out a long time ago. So you might see a documentary somewhere in the future. So feel free to reach out. You don't need to be a mental health any expert, just someone who cares about that. So feel free to email us for more information about those opportunities. And of course, contribution. We cannot do this without money, okay? Please donate to Psychbabble, donate to Neem, donate to Cam, anyone that your heart flows towards today. We would really appreciate it. And so, as always, we share some resources here. We're happy to share these slides as well if you would like some of that information, resources in Nigeria, as well as resources here in the US. So thank you so much. These are their contacts. Feel free to take a screenshot of that. And if there are no questions or comments, again, we really appreciate you. Shout out to Amarachi. I know she didn't, she just said, oh, I'm Amarachi, Amarachuku. Kokoro, right? She's doing amazing work at Iruka. Please check her out. I had her slide here. Also, I think her contact is on there. If not, I would add it. But she's back in Nigeria right now, right? So part of what we're talking about, let's not be detached. I know a lot of us won't, choose to go home or have the opportunity to do so. But there's so much that we can do. And she's a testament as a young person to that impact. So if you saw her slide as well, please, be a part of these different initiatives. Okay. So let's not just come and hear, let's take action as well. All right. So we appreciate you all. Thank you for coming to this year's talk, and we will see you next year. Take good care, y'all.
Thank you, everybody.
Y'all.